Suicide. Understanding the silent crisis and how we can prevent it. Every year, hundreds of thousands of people around the world die by suicide. According to the World Health Organization, suicide is one of the leading causes of death globally, particularly among young people. Behind every number is a real person, a son, a daughter, a friend, a colleague, a neighbor, someone who once had dreams, relationships, and hopes for the future. Yet many of these individuals were silently struggling with emotional pain that others could not see. Today, we are going to talk openly about suicide, what causes it, why people reach that point, and most importantly, what we can do to prevent it. Because understanding suicide is one of the most important steps towards saving lives. Understanding suicide. Suicide is a complex public health issue. Research from the Centers for Disease Control and Prevention shows that suicidal behavior is rarely caused by a single factor. Instead, it usually develops from a combination of psychological, social, and environmental influences. Many people who experience suicidal thoughts are not necessarily seeking death itself. Often, they are trying to escape overwhelming emotional suffering. Feelings of hopelessness, loneliness, or intense psychological pain can make people feel trapped, as if there is no solution to their problems. But these feelings, although extremely painful, are often temporary and treatable. Major risk factors. According to research from the National Institute of Mental Health, several factors can increase the risk of suicide. One major factor is mental health conditions. Depression, anxiety disorders, substance use disorders, and other psychiatric conditions can significantly affect how a person thinks, feels, and copes with stress. However, mental illness alone does not explain every case. Other contributing factors may include relationship problems, financial stress, academic or work pressure, loss of loved ones, chronic illness, or physical pain, social isolation. These stressors can interact and accumulate over time, making individuals feel overwhelmed and emotionally exhausted. Warning signs. Recognizing warning signs can help prevent suicide. Many people show signals before a crisis occurs. Some common warning signs include talking about feeling hopeless or having no reason to live, withdrawing from friends and family, significant changes in mood or behavior, increased substance use, giving away important belongings, expressing feelings of being a burden to others. According to the Centers for Disease Control and Prevention, noticing these signs early and responding with support can make a critical difference. Why talking about suicide matters? For many years, suicide was rarely discussed openly in society. Stigma surrounding mental health often prevents people from seeking help. But research and public health experts now emphasize that open conversations about mental health reduce stigma and encourage individuals to seek support earlier. Creating safe spaces for people to talk about their struggles can help them feel less isolated and more understood. Prevention. What works? Suicide prevention involves multiple levels of support. According to global health research, effective strategies include expanding access to mental health services, strengthening community support systems, increasing awareness and education about mental health, reducing stigma around seeking psychological help, therapy, counseling, crisis support services, and social support networks all play essential roles in helping individuals navigate difficult periods in their lives. Many people who once experienced suicidal thoughts later recover and lead meaningful, fulfilling lives. Supporting someone who may be struggling. If you suspect that someone around you may be struggling emotionally, your response matters. Experts recommend several important steps. Listen without judgment. Take their feelings seriously. Encourage them to speak with a qualified mental health professional. Most importantly, remind them that they are not alone and that help is available. Sometimes, simply being present and showing genuine care can have a powerful impact. If you are struggling, if you are currently experiencing thoughts of suicide, please remember that support exists. Mental health professionals, counselors, crisis support services, and trusted individuals can help you navigate these feelings. Reaching out for help is not a sign of weakness, it is a step toward healing and recovery. Many people who once felt hopeless later discover new purpose, connection, and meaning in their lives. Summary. Suicide is one of the most serious public health challenges facing our world today. But it is also one of the most preventable tragedies. Through education, compassion, early intervention, and accessible mental health care, we can protect vulnerable individuals and support those in need. Every life has value. Every person deserves understanding, support, and hope. And sometimes, the simple act of listening can help someone find the strength to keep going.